Um, Hello, everyone. My name is Tong from Peking University. Today, I would like to present talk about sustainability to the health effect of air pollution. Well, the reason we have been paying such attention to the air pollution and the health effect because we all know that it causes significant health impacts globally, leading to 4 million premature deaths. So the evidence of the health effect of air pollution are well documented. In the meantime, the new health effects of air pollution have been increasingly reported. Besides the traditional knowing about the respiratory and the cardiovascular effects, now there's also increasing report about the preterm birth effect of PM, such as the recently published paper about the acute and chronic effect of ambient and fine particulate matter on preterm birth in Beijing. And also, there's also a study, we found that the pregnant nurse in Africa is also associated with exposure to the PM2.5 in that continent. There's also more and more attention paid to the hypertensive disorders in pregnancy. It's all relevant to the pregnant women and also birth of the health effect is associated with air pollution. Besides this one, there's also a document regarding the mental health. So all these results or report suggest air pollution is very important issue, and we should pay a lot more attention to that. We found there's still high uncertainty, such as the Global Exposure Mortality Model, which combine major cohort study globally and established the so-called the exposure and the response model to estimate the risk ratio of the mortality associated with PM2.5. And we see high uncertainty associated with that. The reason I believe this large or high uncertainty or large variance in the relative risk in this dose response function is because we assume all the aerosol particles are the same and all the individuals are the same. However, we know air pollutants, especially PM2.5, is very complicated issue, and the health effect is depends on a lot of variations, such as the time after exposure, the component of fine particles, and the size of fine particles. And more attention now paying to the group or subgroup of population who are more susceptible to the air pollutants, such as elderly, children, and female, male, or the people with different socioeconomic status, or people with disease. And when we look at this large variation, we can attribute the reason behind that. Usually we see there's in the epidemiological studies, first we have a lot of errors. The random errors or systematic errors are contributing to this large variation. Besides this one, there's also exposure misclassification, as well as now more and more attention paid to the size and the chemical components of PM2.5 are contributing to this large variation. And finally, people at a different area, people at a different age, people at a different stage of the disease have a different susceptibility, and this is also a very important factor contributing to the large variation in the relative risk. So in that sense, we come back to the reason we think that in the epidemiology study, we usually assume that each individual are the same, but as a matter of fact, people are different. and the different people response to the air pollutants are different, then cause the large variation. So this is a figure showing that if we focus on more susceptible individual, then we have a larger and higher health factor than the less susceptible individuals. But why do we care? Because the study of the susceptibility, it helps us to mitigate the effect of air pollution by individually who can shift their behavior or taking the individual protection. This is adaptation for individual to protect themselves. And more importantly, in a society, we need to pay more attention to those susceptible individuals. This has the reason for the environmental equality, and it's very important to set the air pollution standards that not only take care of the general public, but also pay attention to the protection of those who are more susceptible to the air pollutants. To find out the macro indicators, we can use the large-scale spatial variation to indicate there is actually this large variation is caused by the sustainability. If we use a country like China or US, we see the study, for this example, we look at the infertilate effect of PM. We see that the different regions actually have a very large difference in the effect. And this difference, usually in the past, we attributed the study methodology of population. Now we think it's a larger spatial difference or spatial heterogeneity is actually associated with certain macro indicator. And to do this one, we use about 20 million records of the singleton births to analyze and use a 12 macro social indicator to group them. And I will skip the details. And I just mentioned that the final results suggest that we see this because of the macro indicator can explain about this large difference in the spatial or if the health effect of the spatial variation. And this gave us the first hint that we can use the macro indicator to explain this spatial heterogeneity. And this is because the susceptibility of the individual or of the subgroups in the country are different. Besides these socioeconomic studies, there's more and more emphasis to understand the mechanism behind that, how the gene-environment interaction can be used to explain this one. So we have a serious study to respond to these questions. Before we start, we need to understand that death and disease is the major indicator of the health effect. But these are just the tip of the iceberg of the health effect caused by the air pollution. Because many health effects, when they already exist caused by air pollution, it doesn't change immediately to the symptom, but it's caused the change in our body. And we see the kind of subclinical pathological or physiological changes. We can use a biomarker to review this change, and we can establish this association biomarker with the air pollution exposure to suggest the change and the mechanism for that. So that is very important to carry out the study to understand the mechanism. Eventually, we can have this individual intervention for that. Another concept to understand, to review this mechanism, we can use a so-called epidemiological study, or called a panel study. panel study is to follow individual, a small group of individuals, to carefully measure their biomarker and the individual exposure, and then we build a association. After repeated visits, collect repeated clinical visits, and also the biomarkers for that. Then we use a statistical model to understand their association. In the past, we have been carrying out a number of panel study, but there's an issue that with a panel study, with a seminar group of people, we cannot tell the difference of who is more sensitive to the air pollutants. So now we carry out the study and have this panel study design with two groups who are very different in the disease status to respond to the question if individuals are more susceptible to the air pollutants. So this is how our panel study design. For example, to address people with pre-diabetes, we focus on the hypothesis. People with pre-diabetes are suffering from the chronic inflammation, and their cardiometabolic and respiratory response caused by the air pollutants could be higher, could be different in the pre-diabetes individuals compared to the health controls. So we carry out a prospective study, compared the cardiometabolic and the respiratory effect air pollutant exposure on healthy and pre-diabetes individuals. So here's how we carry out our study. And this study will carry out at Peking University Hospital, and we recruit the subjects who generally came to the hospital for the health test, and then we identify the volunteer who is filled within our standard of recruitment, and then we follow up their health condition, invite them come to the clinic to do the test, and also ask them to carry out the personal assumption for that. So the results shows that clearly that all the subjects of this study have a clear response or association with exposure to the air pollutants. This is a different biomarkers like the nitrogen oxide in the breath air, exhale air, white blood cell, and different cytokines. And the red shows that we can see a significant association of this biomarker with the PM2.5 exposure. And this figure shows that with shadow here, like IO2, like white blood cell, and like the blood pressure, those who with pre-diabetes are more susceptible to the air pollutants. Here in the nitrogen oxide of XLL, we call FeNO, we don't see that pre-diabetes is more sensitive to the compared to the health individuals. But then we carry out the following careful study, and we look at the FeNO with the exposure of different particulate matter like PM2.5, black carbon, ultrafine particles, and particle in the accumulation mode. We see clearly a strong association of all the individuals. After using the fasting blood glucose or insulin resistance to differentiate of the subject with pre-diabetes and also who are healthy, we see clearly that a number of air pollutants, the exposure to these air pollutants, people with pre-diabetes are more sensitive than the healthy one, like PM2.5 and black carbon and ultrafine particles. The same concept is also working for the people with chronic obstructive pulmonary disease. So we hypothesize that airway inflammation response caused by short-term air pollution exposure were different in COPD patients and health controls. This is a nice figure showing that we see people with COPD without, they maybe respond differently. But this is just a concept. We think it could be important. Therefore, carry out a study we call COPD in Beijing, or COPDB. And this study was located in Sisahai community. So same like the others, we had a matrix of biomarkers air pollutants. So what we found is similar as before. When we carry out the more detailed studies by pull off this information, and we can see certain pollutants have a clearly significant difference between the COPDs and health controls. Then we we choose these pollutants, then carry out two pollutant study to see if they are robust or not. Then we found carbon monoxide, nitrogen oxide, sulfur dioxide, and PM2.5, where those people with COPD are more sensitive to the air pollution exposure than the health one. So this is a very important evidence that we can see that in the sense of respiratory inflammation, and COPD patients are more susceptible to the air pollutants than the health individuals. Of course, this gave us a very important rich for information about the different biomarkers associated with different air pollutants. But what's the mechanism behind that? Usually, if we following up this omic method from DNA, RNA to protein and metabolism, it can help us to understand the mechanism. We are able to collect each individual's biosample, especially blood sample, to do the DNA, RNA test, and then we can carry out the following studies. So the previous study, when we use the COPD patients, we carry out the RNA sequential analysis. We identified thousands of genes, and we found that there is significant difference between the COPD patient and health controls in the sense algorithm of the different expression of the genes in these two figures showing that. Use this rich for information, and we can run off certain kind of software like Metacore, and we can identify top 10 pathway that are associated with the health effect caused by the air pollutants. And one example of is like the epithelial cell apoptosis in COPD, and suggesting that air pollution exposure trigger a certain kind of pathway, then gradually leading to the epithelial cell apoptosis. So this is another example suggesting that we can use the RNA or epigenetics to understand the health effect mechanism of air pollution. I think I should stop here and with a brief summary that our study suggesting that to understand the susceptibility of individuals, we can use either microindicator to review the socioeconomic status of individual and how this SES associated with air pollution health effect. And more now we can use take the advantage of biotechnology to understand the gene-environment interaction, and based on the biomarkers and the multi-omics to understand the mechanism. And finally, I want to emphasize the importance of studying the susceptibility is to help individuals to understand their body, how it responds to the air pollution, and it could be more sensitive to the others. And so individuals should take their responsibility by shifting their behavior or by taking individual preventative measures. And more importantly for the public, it's very important to consider the concept of environmental inequality to ensure that we not only protect the general public, but also protect those who are more vulnerable to the air pollutants, like children, elderly, and the people with disease. So I would like to thank you for your attention, and I also thank my students and also thank the funding agency for this report. Thank you.